Assalamu alaikum, hello and good day everyone. In this Journal Club review, we will be introducing an interesting and innovative study design that has been around for the past 2 decades but has been increasingly adopted lately, which is the Mendelian randomization. What is it and how does it work? Broadly, it's a statistical framework that attempts to figure out if some exposure causes some outcome. In our dental and medical research, finding the causation is the ultimate goal because, for example, if diabetes causes apical periodontitis, then preventing or treating diabetes would reduce the risk of apical periodontitis. So let's say we want to know whether diabetes causes apical periodontitis, we would identify people with and without diabetes, follow them over time, and see if those with diabetes would develop more apical periodontitis. But we should be careful because what we just described is an association, not causation. And we know very well that other factors like diet, lifestyle, exercise, or access to dental care can influence both the diabetes and the apical periodontitis outcomes. These factors are known as confounders, which are the variables that are linked to both the exposure to diabetes and the outcome, in this example, the apical periodontitis. And there are significant limitations in the cross-sectional observational studies. Although we do have some statistical tools to try to account for these confounders, such as performing regression analysis, none of these are perfect. And if we really want to get at causation, we should do a randomized clinical trial, but these cannot always be practical. They could be unethical, expensive, and in this example, it's not practical to randomly assign people to develop diabetes just to see what happens. So Mendelian randomization gets around these issues through an interesting epidemiological trick. We know that many lifestyle factors might be associated with both diabetes and apical periodontitis, but there are also genes that are associated with a higher risk of diabetes. Some people are born with genetic variants that predispose them to diabetes throughout their lives. Whether we get one of these genes or not, practically speaking, it's all random. It has nothing to do with behavior, diet, or habits. It's an accident of birth. So if diabetes truly causes apical periodontitis, then people who are genetically predisposed to diabetes should have a higher rate of apical periodontitis. On the other hand, if diabetes is just a marker for other health-related behaviors, then having a genetic predisposition to diabetes shouldn't affect the apical periodontitis risk. This is a genius of Mendelian randomization, where we could use the genes people have had their whole lives, genes that never change, to get around the web of life choices that confound observational studies. The brilliance of it is that it uses genome-wide association data from over 500,000 individuals to perform the Mendelian randomization analysis, not just on diabetes, but also on many other classic apical periodontitis risk factors that are related to the host, including oral hygiene and inflammation, all factors that are associated with apical periodontitis but haven't been proven to cause it. The underlying concept of this Mendelian randomization dates back to the 1990s, when researchers began to realize that genetic variants could serve as an unconfounded proxies. Till 2003, when a landmark paper by Davy Smith published in the International Journal of Epidemiology under the title Mendelian Randomization: Can Genetic Epidemiology Contribute to Understanding Environmental Determinants of a Disease? The study we have today by the Chinese group Wang and colleagues, which was published in 2024 at the IEJ, employed this study design where they used the bidirectional Mendelian randomization to explore the potential two-way causal relationship between the pulp and periapical disease and type 2 diabetes mellitus. They aim to investigate both possible causal directions between the two diseases rather than assuming only a one-way influence. In the first direction, they tested whether a genetic predisposition to pulp and apical periodontitis could increase the risk of developing diabetes mellitus. And in the reverse direction, they tested whether a genetic predisposition of diabetes could increase the risk of developing pulp and apical periodontitis. While randomized clinical trials uses random assignment to allocate individuals to treatment or control groups to estimate the causal effect of an intervention, and the Mendelian randomization, however, uses genetic variants, which are the single nucleotide polymorphism, as an instrumental variable. This randomization ensures that the treatment assignment is independent of confounders, both the known and unknown, and therefore the treatment assignment can be used as a natural instrumental variable because genetic variants are randomly assigned at conception according to Mendel's law. They used two-sample Mendelian randomization from two different genome-wide association datasets. The first one was taken from FinGen, which is based in Helsinki, from Finnish participants, and the second was the UK Biobank Association, where all participants were European, recruited across England, Scotland, and Wales. The study selected 16 genetic variants, SNPs, associated with pulp and epicarditis, and 181 SNPs associated with diabetes mellitus. Coming to the results, there was no significant causal relationship in either directions, since the odd ratio value of the meta-analysis was 1.04, which is almost equal to 1. That suggests that the risk of diabetes mellitus in patients with pulp and epicarditis may be nearly equal to that of those without pulp and epicarditis, meaning there is no genetic evidence to support a direct causal link between pulp and periapical disease and type 2 diabetes mellitus. Therefore, the study concluded that there is no significant evidence of a genetic predisposition for pulp and epicarditis causally affects type 2 diabetes mellitus and vice versa. The main advantages of this study design is the large sample size taken from the genome-wide association data, which is capable of providing sufficient statistical power to detect the underlying causal relationships, even if the causal effects are small. Second, the concept of Mendelian randomization analysis sets the foundation to avoid confounding factors and other biases, which ensures the reliability of causal inference. On the other hand, the limitations of this paper is that it was conducted exclusively in individuals of European population, which limits the generalizability of the findings to other ethnic groups, and that the pulp and periapical diagnosis was defined based on the international classification of disease codes, which could lead to misclassification if the diagnosis was inaccurate. Finally, these findings are based solely on genetic associations and were not validated with clinical or biological data, which is important for confirming real-world scenarios. Lastly, although the results were not statistically significant, this study demonstrates the value of Mendelian randomization as a powerful tool to determine whether one disease truly causes another by using genetic data, rather than relying on observational studies, which are often influenced by confounding factors. And it can be adopted particularly where randomized controlled trials are unethical or unfeasible. We can conclude that Mendelian randomization helps clarify which associations are truly causal and which are not, and that clarity is critical for effective prevention and treatment strategies. So that's the Mendelian randomization. Thank you so much for listening. Hope you have a great day.